اوكي. بسم الله الرحمن الرحيم. السلام عليكم جميعا. واضح الصوت؟ سمعيني كويس؟ واضح الصوت؟
واضح دكتور.
Today إن شاء الله رح يكونوا آخر محاضرتين Pathology in the GI tract. رح نحكي فيهم على diseases of the gallbladder and extrahepatic biliary tree، ورح نحكي على Exocrine Pancreas. So for diseases of the gallbladder اللي رح نحكي عنهم mainly هم Gallstone disease والCholecystitis. So Gallstones اللي هم أي شيء related to the gallbladder بنسميها coli. Okay, so Cholecystitis اللي هو gallstones of the gallbladder. Cholecystitis is inflammation of the gallbladder. Other diseases اللي ما رح نحكي عنهم اللي هم choledocholythiasis. Choledocholythiasis means اللي هم gallstones لما تدخل على البيلياري tract، لما تدخل على البايل ducts وبنسميها choledocholythiasis. Cholangitis حكينا it is inflammation of the biliary tract or biliary system outside the liver. Extrahepatic biliary atresia is a condition that affects children mainly, and they present with obstructive symptoms, obstructive jaundice mainly. ما رح نحكي عنهم هدول اللي in gray color. Tumors, carcinoma of the gallbladder is not much common، عشان هيك ما رح نحكي عنها. Cholangiocarcinoma كمان is not very common, it's very rare، وحكينا عنها in the context of the primary sclerosing cholangitis if you remember, إنه it increases the risk of having cholangiocarcinoma. أول condition اللي هو الكوليليثايسيس. الكوليليثايسيس زي ما حكينا اللي هو development of stones inside the lumen of the gallbladder. It is relatively common, so it affects 10 to 20% of adult population in the West. It has higher incidence in Latin America and lower incidence in Asian people. It's mainly of two types, either cholesterol stones, which accounts for 80% of the cases, or pigment stone, which accounts for the remainder. Sometimes في إشي بنسميه mixed stones، يعني بيكونوا composed both of cholesterol and bile pigment. Clinical features, most of the time, 70 to 80% of the cases, gallbladder stones remains asymptomatic. ما بيكون عند patient symptoms. Sometimes it could be discovered incidentally during ultrasound examination for any other reason أو أي imaging technique for any other reason. Remainder becomes symptomatic in a rate of 1 to 3% per year. Mainly present with right upper quadrant pain, either constant or colicky. وبالعادة gallbladder pain, if it is just stones بدون inflammation, بيكون vague pain. يعني بيكون في عندهم right upper quadrant pain, which is colicky mainly. Colicky يعني بيشدوا برخي. It is mainly related to fatty food أكتر شيء. يعني بعد ما يأكلوا fatty meal, fat rich meal بصير في عندهم right upper quadrant pain, which is vague pain إذا كانت بس stones. لما يصير في inflammation هلا رح نشوف later on بيكون ال pain is more severe، بيصير أسوأ ال pain. Complications of cholecystitis, acute and chronic cholecystitis اللي هو inflammation of the gallbladder. Choledocholythiasis زي ما حكينا ممكن stones, especially if it is small in size, it passes through the cystic duct حتى توصل على the biliary system. Cholangitis ممكن it might induce inflammation of the bile ducts. Pancreatitis, especially for small stones. رح نحكي على pancreatitis in detail. Sometimes إذا كان small stone, it passes from the gallbladder into the ampulla of water, and it lodges itself and the connection ما بين الامبولا of water, the connection of the bile ducts مع ال pancreatic duct. بتعمل لي obstruction and it might lead to pancreatitis. Pyema, perforation, fistulas, and gallstone ileus اللي رح نحكي عنها كلها. Carcinoma of the gallbladder is a very rare complication of chronic cholecystitis mainly. هاي الكيسز اوف او البوسيبل سيناريوز اللي بتصير بالناس اللي عندهم stones. They either remain quiescent اللي حكينا in the majority of cases ما في symptoms. لما يصير في واحد من الsymptoms blocks the cystic duct ممكن يعمل لي acute cholecystitis. بصير في lodgement and dislodgement. اوكي بصير فيها lodgement اللي هو obstruction and dislodgement leading to recurrent bouts of acute cholecystitis sometimes. يعني لما تسكر تعمل شوي acute symptoms, acute inflammation, لما تفتح برجع للنورمال. اوكي but this is cases of acute cholecystitis. If it is not very severe وما طول obstruction, it remains and resolves in 2 months or so. Okay, so this is the first scenario لما يكون في عند patient gallbladder stones اللي هو acute cholecystitis which resolves within 2 months. لما يكون في obstruction and relief of obstruction يعني سكر الستون سكر الcystic duct بعدين رد فتح الcystic duct بيرجع يصير في resolution. Pyema and mucocele, which is the second possible complication of gallstones اللي هم الناس اللي بصير في عندهم زي ما حكينا obstruction of the cystic duct and this obstruction persists. بضلوا الستون ما بروح من مكانه. In this case ببلشوا ب acute cholecystitis. If the obstruction persists بصير إشي بنسميه الإمبايما. Pyema معناها collection of pus inside the lumen of the gallbladder. لما يصير في obstruction بصير في pus collection and for empyema to happen لازم يكون في عندي bacterial infection. okay لازم يكون في contaminating bacteria عشان يصير في pus formation and this pus formation because there is permanent obstruction بصير في عندي collection of pus inside the lumen بنسميها empyema. okay السكند سيناريو اللي هو الميوكوسيل لما يكون ما في بكتيريا يعني in the absence of bacterial infection إذا صار في lodgement of the gallbladder stone and it persists بدون بكتيريا يصير في collection of mucus secretion يعني mucin inside the lumen بنسميها mucocele يعني mainly بيكون mucin ما في بكتيريا بنسميها mucocele. perforation in some of the cases بصير في عندي very acute severe inflammation in the gallbladder مع other precipitating conditions يعني بيكون ال patient عنده gallstones أو بيكون في عنده other severe diseases عملت له hypovolemia or so on. هلا رح نحكي عنها in details اللي هو ال acute acalculous cholecystitis. بيكون في very severe inflammation which progresses very rapidly. For gallbladder is the superior aspect of the gallbladder lies on the liver. يعني بيكون الليفر ماسك فيها هيك. okay يعني بتكون هيك زي قاعدة على الليفر من تحت. okay هاي الجولبلادر. so إذا صار في perforation من جهة الليفر تعمل لي liver abscess. okay إذا صار في perforation من ال free aspect of the gallbladder اللي هي mainly anterior inferior part of the gallbladder بيعمل لي peritonitis. okay مفهوم لهلا؟ The second complication or scenario اللي هي الفستيلا development لما يكون في big stone which is continuously irritating the connection of the gallbladder between the area between the gallbladder and the duodenum بيعمل لي مع ال repetitive irritation ممكن يعمل لي fistula formation. لما يعمل fistula ممكن الستون ينزل through the small intestine يعمل لي إشي بنسميه الجولستون إيليس. Gallstone ileus اللي هو due to irritation of the gallstone على ال wall of the small intestine بصير في عندهم زي paralysis بصير في intestinal obstruction and paralysis ببطل في movement proper peristaltic movement in the GI tract بنسميها gallstone ileus. sometimes إذا كان big enough ممكن يصير في impaction ويعمل لي mechanical obstruction, mechanical intestinal obstruction إذا كان very big. If it is small مش عامل يعني it is not sufficient to cause obstruction of the lumen, بيعمل irritation of the wall وممكن يعمل لي gallstone ileus يعني زي paralysis, يبطل يصير في proper movement of the GI tract. مفهوم لهلا؟ مفهوم ولا مش مفهوم؟ ولا؟
مفهوم دكتورة.
حدا عنده سؤال؟ طيب نيجي على الكرونيك cholecystitis and carcinoma. حدا عنده سؤال؟ chronic cholecystitis عادل chronic cholecystitis. اوكي عندك سؤال يا مين اللي بيحكي له جاين؟ Okay. So for chronic cholecystitis and development of carcinoma, most of the cases of chronic cholecystitis بيكون فيها أول شيء it could be related to recurrent bouts of acute cholecystitis. ممكن تكون related to bacterial contamination, يعني bacteria which infects the gallbladder بتعمل لي chronic inflammation rather than acute inflammation. In a very minor part أو subset of chronic cholecystitis يعني chronic inflammation of the gallbladder. In a very minor subset بصير في عندي very severe thickening of the wall. بعدين it might be followed by development of a gallbladder carcinoma. Okay, this is a very limited subset of chronic cholecystitis اللي هي بتكون شكلها characteristically very يعني لما نطلع على الجول بلادر بتكون من زي very rigid, بتكون فيها very rigid wall. This happens in a minor subset. Okay, هذا كله اللي كنا نحكيه are possible scenarios or complications that are related to development of gallbladder stones. مفهوم لهلا؟ حدا عنده سؤال؟ اوكي نيجي على الكوليسيستايتس. يعني اول شيء كنا نحكي على الكوليليثايسس اللي هو stones of the gallbladder. هلا رح نحكي على الكوليسيستايتس اللي هي inflammation of the gallbladder وحكينا عنها in brief in some of the drawings اللي حكيناهم. Cholecystitis is divided into acute cholecystitis, chronic cholecystitis, and some cases بيكون in a background of chronic cholecystitis بصير فيه acute inflammation. Acute cholecystitis is divided into acute calculous cholecystitis. Calculus معناها stone related, يعني لما يكون فيها stones inside the lumen of the gallbladder بنسميها acute calculous cholecystitis. The second subset acute calculus يعني without the presence of stones, يعني ما في بالlumen stones بنسميها acalculous cholecystitis. Chronic cholecystitis and acute unchronic. Acute calculous cholecystitis is much more common than acute acalculous cholecystitis. It is seen in 90% of cases. يعني there has to be stones in the lumen in 90% of cases of acute cholecystitis. It is precipitated by obstruction of the gallbladder neck or cystic duct. إذا بتتذكروا حكينا على الفيرست سيناريو إنه بصير في obstruction بصير في acute inflammation. If the obstruction resolves بيروح الانفلاميشن. If it does persist ممكن يصير في عندي perforation, severe acute cholecystitis, mucocele, empyema, and so on. The stone causes or obstruction causes chemical irritation of the gallbladder wall, and this is followed by bacterial contamination later in the onset of the disease. لما يصير في عندي bacterial contamination مع obstruction by a gallstone مع irritation of the wall بصير في عندي acute inflammation, and this inflammation بنسميه acute calculous cholecystitis لأنها it's caused by stones. Acute non-calculous أو acalculous cholecystitis, it is much less common, about 5 to 12% of acute cholecystitis cases. هدول الناس بيكون عندهم generalized hypoperfusion بيكون في عندهم other serious conditions, underlying serious conditions زي post-operative status after major surgeries, severe trauma, severe burns, or sepsis. Sepsis اللي هو the presence of bacteria inside the blood. Contributing factors ليش بصير في عندهم cholecystitis؟ لأنه بصير في dehydration, the gallbladder stasis, compromise on the blood supply of the gallbladder as a whole. يعني كل الجسم بيكون فيه compromise of blood supply من ضمنهم الجولبلادر. And bacterial, secondary bacterial contamination بصير في عندي acute acalculous cholecystitis. So acalculous أو non-calculous cholecystitis بتصير بالناس اللي severely ill اللي عندهم generalized dehydration, generalized hypoperfusion. morphology في acute cholecystitis إذا شلت الجول بلادر وطلعت عليها إيش بشوف؟ في acute inflammation elsewhere there will be edema of the wall, fibrinous exudates على surface, hemorrhage and sloughing of the mucosa, and sometimes collection of pus or turbid fluid, turbid bile in the lumen. This is the appearance from outside. هاي مفتوحة الجول بلادر. Okay, this is the wall and this is the mucosa. Next is a closed gallbladder مسكرة لساتها. شايفين الفبرينس exudates on the surface وقديش الجولبلادر is swollen. ده أكبر من الحجم الطبيعي للجولبلادر. Okay. Under the microscope زي الacute inflammation elsewhere فيها زي الacute inflammation elsewhere فيها neutrophilic infiltration, hemorrhage, sloughing of the mucosa. شايفين ما في mucosa كلها رايحة. There's edema in the wall. وفيها hemorrhagic areas and sometimes frank pus and abscess formation. نيجي على chronic cholecystitis. chronic cholecystitis زي ما حكينا بعد repeated bouts of acute cholecystitis ممكن يصير في عندي chronic cholecystitis. The other thing إنه it can arise as chronic cholecystitis from the beginning. زي ما حكينا gallstones could aid in the generation by forming recurrent bouts of acute cholecystitis. The most important contributor of the gallstones اللي هم obstruction أو recurrent acute cholecystitis is the supersaturation of bile. لأن زي ما حكينا بصير في obstruction dislodgement. This leads to increase in the concentration or the supersaturation of bile inside the gallbladder due to recurrent obstruction. This leads to chronic inflammation, and most of the time زي ما حكينا bacteria plays a role in chronic cholecystitis زي E. coli والenterococci. It can be cultured in 1/3 of cases, so a high percentage of people living in chronic cholecystitis, they prove to have some sort of bacterial infection. شكل الجول بلادر بالchronic cholecystitis usually بيكون فيها thickened bladder. الميوكوزا كمان بتكون altered بس ما فيها features of acute inflammation. ما فيها prominent hemorrhage, ما فيها prominent edema. And gallstones also may be present. هاي مفتوحة gallbladder, and this is a very big gallbladder stone. Okay. Under the microscope, there are a group of features بنشوفها بالchronic cholecystitis. من ضمنها thickening of the wall thickening, and the development of إشي بنسميه Rokitansky-Askov sinuses. Rokitansky-Askov sinuses اللي هو through recurrent bouts of inflammation مع chronic cholecystitis as well. Part of the mucosa herniates into the underlying submucosa or underlying wall of the gallbladder زي هاي appearance زي هاي الجلاند. Okay. هاي بنسميها Rokitansky-Askov sinuses, and it is a very common feature بنشوفها بالchronic cholecystitis. Okay, this is another. شايفين كيف بلشت الجلاند to herniate into the underlying tissue مع prominent chronic inflammation هون. The wall is thickened if you pay attention. This is not the normal thickness of the gallbladder wall. بالعادة بتكون very thin, few millimeters. The gallbladder wall thickness normally. Okay. complications of cholecystitis sometimes بصير في عندي development of زي ما حكينا of bacterial infection that travels to the bile ducts اللي هو extra hepatic bile ducts تعمل لي cholangitis. Sometimes it might cause sepsis in cases especially of severe acute cholecystitis. Gallbladder perforation زي ما حكينا and local abscess formation. Gallbladder rupture might lead to diffuse peritonitis. حكينا إنه إذا كان في if it develops on the surface facing the liver بتعمل لي abscess. If it develops in the free face of the gallbladder بتعمل لي diffuse peritonitis. Biliary enteric cholecysto-enteric fistula زي ما شفنا بالpicture. Gallstone induced intestinal obstruction أو gallstone ileus حكينا عنها. And aggravation of pre-existing medical illness. يعني sometimes it worsens the condition of the patient. هذا عنده سؤال؟
دكتورة البرفوريشن بصير من مثلا من progressing ascoff sinuses؟
لا الperforation is commonly a complication of acute cholecystitis rather than chronic cholecystitis. Sometimes احنا حكينا acute cholecystitis ممكن يكون very angry cholecystitis ممكن يعمل لي gangrene يعني total necrosis of the wall ويعمل لي perforation. Okay. Sometimes this process could be localized يعني واحد من ال walls of the gallbladder progresses يعني inflammation progresses in this area of the wall very rapidly. يعني usually it's a complication of acute cholecystitis rather than chronic cholecystitis.
تمام شكرا.
حدا عنده سؤال قبل ما نبلش بالبنكرياس؟ Okay, so in the coming few slides رح نحكي على البنكرياس. As you know, this is just a revision of the normal anatomy. أنتوا بتعرفوا إنه البنكرياس lies in the duodenum, اللي هو head of the pancreas, very closely to the duodenum. It joins, إحنا بنعرف common bile duct joins the pancreatic duct هون, and they empty in the duodenum through the ampulla of Vater. Okay. عشان هيك حكينا إذا كان في gallstones ممكن تعمل لي obstruction of the pancreas تعمل لي pancreatitis لأنه they are closely related. They join each other before entering to the duodenum. The pancreas is composed mainly of three parts اللي هم the head of the pancreas, the body of the pancreas, and the tail of the pancreas. If you pay attention شايفين the head of the pancreas is very closely related to the duodenum and it is very closely related to the common bile duct. يعني common bile duct فعليا it passes through the pancreas to empty in the ampulla of Vater. عشان هيك later on لما نشوف the conditions affecting the pancreas, persons اللي عندهم pancreatic cancer مثلا affecting the head of the pancreas ممكن يصير عندهم obstructive jaundice. اوكي ليش obstructive jaundice؟ لأنه يصير في pressure على common bile duct وبيعمل لي obstruction of the common bile duct and it might lead to obstructive jaundice. اوكي طيب اللي رح نحكي عنه اليوم in the context of the GI tract اللي هم pancreatic exocrine function rather than the endocrine. Pancreatic endocrine function رح نحكي عنها بالendocrine system. So what we are interested in اللي هو pancreatic acini. احنا بنعرف انهم pancreatic acini they secrete pancreatic enzymes and they join in a stepwise manner حتى يعملوا لي اللي هم ducts حتى يوصلوا للpancreatic duct. نعرف another thing إنه pancreatic enzymes are in the inactive forms لحتى يوصلوا على الduodenum ويصير لهم activation. So they have to be in the inactive form عبين ما يطلعوا من البنكرياس. بس يطلعوا من البنكرياس ويوصلوا على الduodenum بيصير لهم activation عشان يعملوا digestion. البنكرياتيك enzymes اللي هم mainly the main parts اللي هم الامylases, الlipases, proteases كلهم they are involved and aid in the digestion of the food that is present in the small intestine. تمام لهلا؟ حدا عنده سؤال؟ Diseases of the exocrine pancreas are variable. It could be related to inherited disorders or genetic disorders like cystic fibrosis, genital anomalies ما رح نحكي عنهم, acute and chronic pancreatitis رح نحكي عنهم لأنه ممكن تشوفوهم بالجراحة. Pancreatic neoplasms رح نحكي على بس ductal carcinoma. They are very many of the lesions in the pancreas. رح نحكي بس على ductal carcinoma. So we'll start by pancreatitis. زي ما بنعرف أي شيء followed by the suffix itis means inflammation of the organ. So pancreatitis is inflammation of the pancreas. It could be acute pancreatitis or chronic pancreatitis. وزي acute inflammation elsewhere لو كان في in acute pancreatitis إذا صار في resolution and total recovery بيرجع البنكرياس into normal if the underlying cause is removed. The chronic pancreatitis زي أي chronic inflammation in the body, it might be complicated by fibrosis. عشان هيك it is irreversible usually. يعني بالعادة لما يصير في fibrosis, chronic inflammation complicated by fibrosis, it is irreversible. It could not go back to normal. Acute pancreatitis ليش مهم تعرفوها؟ لأنه it is clinically variable presentation. يعني بالعادة بيكونوا patients have very variable presentations, very variable severity. Sometimes الناس اللي عندهم acute pancreatitis ممكن يصير في عندهم only focal edema and fat necrosis, و sometimes ممكن البنكرياس كله يتحول ل necrotic tissue. Acute pancreatitis is one of the medical emergencies أو surgical emergencies, okay? يعني الناس اللي بيجوا acute pancreatitis they present هلا رح نشوف with very serious sequelae. ممكن يصير في عندهم electrolyte imbalances, ممكن يصير في عندهم complications related to hypocalcemia which is very serious لأنه electrolyte imbalances مع hypocalcemia ممكن they might affect the heart, ممكن يعملوا لي arrhythmias in the heart. So it is a very important emergency. The other thing إنه if it is detected early وشلنا ال underlying cause برجع للنورمال. If it is not detected early ممكن زي ما حكينا it might lead to very serious sequelae. So it is treatable. So it's a group of reversible lesions characterized by inflammation of the pancreas. زي ما حكينا it ranges in severity from focal edema and fat necrosis to widespread parenchymal necrosis with severe hemorrhage. 80% of cases are due to biliary tract diseases or alcoholism. So the major contributing factors of acute pancreatitis أهم شيء الalcoholism. Second is biliary tract disease. بالأماكن اللي ما فيها alcoholism is not very common. So etiological factors of acute pancreatitis زي ما حكينا alcoholism is very important contributing factor. Hyperlipoproteinemia and hypertriglyceridemia هدول these both conditions where there are hyperproduction of free amino acids وهدول free amino acids are toxic to the pancreas. Hypercalcemia and hyperparathyroidism. Drugs like thiazide diuretics. Hereditary causes زي ال SPINK1 and PRSS1 هدول they play a role in the maturation of the components أو the constituents of the pancreatic cells. فبيكون في هدول الناس اللي عندهم these genes are more predisposed to have pancreatitis and they carry higher risk of developing pancreatic cancer. Gallstones زي ما حكينا in 75% of the cases ممكن يكونوا يعملوا obstruction and might lead to هلا رح نشوف mechanism of acute pancreatitis to abnormal أو premature activation of the pancreatic enzymes لأنه صار في sort of obstruction. Trauma, iatrogenic injury ال ERCP اللي هو التنظير ال biliary system. Peri-ampullary tumors لأنها بتعمل obstruction. biliary sludge كمان بيعمل obstruction. and parasites زي الأسكارس lumbricoides كمان بيعمل obstruction. vascular causes shock atheroembolism, vasculitis أو polyarthritis nodosa كلها affects the normal blood supply, the normal architecture of the pancreas. Infections like mumps, Coxsackie virus, mycoplasma pneumonia, and subset اللي هو 10 to 20% remains of unknown underlying cause. كيف بتصير الأكيوت pancreatitis؟ إحنا حكينا the primary abnormality بالأكيوت pancreatitis اللي هو there has to be injury to the acinar cells. This is followed by stepwise يعني كل ما لما يصير في injury to the acinar cells بيصير في more release of the enzymes that aids in more and more of the injury or necrosis of the acinar cells. So what happens? Ductal obstruction اللي هم حكينا عنهم زي مثلا cholecystitis اللي هو gallbladder stones, ampullary obstruction, chronic alcoholism and ductal concretions اللي هم حكيناهم sludge. Mechanism is that these obstructive symptoms they cause edema of the pancreas and they lead to ischemia as net result. إنه لما يصير في edema بصير في pressure on the blood supply of the pancreas ممكن يعمل لي ischemia. Ischemia leads to acinar cell injury. لما يصير في acinar cell injury بصير في activated enzymes اللي بتعمل لي more and more inflammation, proteolysis, fat necrosis, and hemorrhage. زي ما حكينا the primary abnormality أو primary direct cause of acute pancreatitis اللي هو activation, premature activation of the pancreatic enzymes due to whatever reason. لما يصير في activation of these enzymes بيعملوا زي auto digestion يعني they digest أو they injure the acinar cells of the pancreas. الأسينر سيل انجري اللي هم زي الالكوهوليزم، دراج، تروما، اسكيميا، فيروسز كلها بتعمل لي أسينر سيل انجري. Leads to intracellular proenzymes and lysosomal hydrolases in an abnormal manner. This leads to activation of the enzymes, acinar cell injury, more and more activation of the enzymes, and further destruction of the pancreas, acute pancreatitis. Some conditions اللي هم زي defective intracellular transport اللي هو واحدة من ال causes of these is alcoholism. It affects the intracellular transport of the enzymes. This leads to intracellular activation of the enzymes if they persist inside the cell for a long period of time inside the lysosomes especially. بيعملوا لي auto digestion of the cell itself. And this leads to acinar cell injury and the further activated enzymes leading to acute pancreatitis. So the hallmark of acute pancreatitis is, especially in severe cases, widespread digestion, auto-digestion of the pancreas. عشان هيك the hallmark of acute pancreatitis is necrosis. أكتر شيء بصير فيهم necrosis ورح نحكي على types of necrosis later on. Morphology زي ما حكينا it starts with edema, necrosis of the pancreas and peripancreatic fat by lipase release and hemorrhage. Fat necrosis combined with calcium to form salts and acute inflammatory reaction follows. وبصير في زي cycle يعني كل ما زاد ال acute inflammatory reaction بزيد ال release of lipases and other enzymes بزيد ال injury and necrosis and so on. لما حكينا على ال causes of acute pancreatitis, if you remember, حكينا ال hypercalcemia is one of the causes of acute pancreatitis. The hypercalcemia it aids in the conversion of intrapancreatic conversion of trypsinogen to trypsin, which aids more and more to the injury. نرجع شوي حكينا هون في complications أو morphology fat necrosis with calcium to form salts يعني بصير في fat necrosis و calcification اللي سميناها if you remember dystrophic calcifications. الcalcifications اللي هم both dystrophic and metastatic calcifications لأنه most of the cases بيكون فيهم hypercalcemia if it is the initiating event بيعمل لي net result is hypocalcemia لما يصير في deposition of the calcium with the fat necrosis بيعمل لي hypocalcemia يعني hypercalcemia is a cause of acute pancreatitis. Hypocalcemia is a complication of acute pancreatitis. مفهوم لهلا؟ حد عنده سؤال؟ اوكي. في شكل الacute pancreatitis. شايفين this area, the head of the pancreas. This area has necrosis. شايفين راح التيشو اللي هون. في auto digestion necrosis in this area in case of acute pancreatitis. Sometimes كل البنكرياس بصير فيه بتحول ل massive areas of fat necrosis. لأنه most of the pancreas is composed of fat, okay? So بصير فيه fat necrosis replacing the whole pancreas like in this case. Okay, زي ما حكينا acute pancreatitis is variable in morphology and severity. Sometimes بس edema, sometimes localized necrosis, sometimes generalized necrosis اللي هو acute necrotizing pancreatitis. بالacute necrotizing pancreatitis, which is a form of very severe pancreatitis, بصير كل البنكرياس is distracted, الacini, the ducts, and even the islets of the Langerhans اللي هم these are the endocrine part. Later on راح يصير فيهم destruction. كل البنكرياس بيكون totally destroyed. Hemorrhagic pancreatitis اللي هو نفس الشيء, extensive necrosis مع hemorrhage and destruction of blood vessels and hemorrhage. These two forms اللي هم acute necrotizing pancreatitis والhemorrhagic pancreatitis are very severe. بالعادة بصير في sudden acute onset loss of the whole tissue of the pancreas. This is hemorrhagic pancreatitis. شايفين كل البنكرياس is turning into hemorrhagic mass. Under the microscope, this is necrosis of the pancreatic tissue. واللي على اليمين هذا fat necrosis. Okay, so this is total necrosis of pancreatic tissue and fat necrosis in the tissues. Sometimes even it reaches the tissues around. يعني مش بس البنكرياس بصير necrotic. The enzymes, they might digest the tissues, the soft tissues around and the fat around. Clinical features زي ما حكينا, it is a medical emergency. Medical emergency يعني بالعادة هدول الناس بيجوا ب very severe abdominal pain اللي هو upper abdominal pain mainly, radiating to the back يعني برجع على الظهر. It is very severe يعني البيشنت ما بيقدر يتحمله يعني. So they present to the emergency department. Pain is the cardinal manifestation. Lab findings زي ما حكينا, they start with elevation of amylase, which is followed by lipase within 24 up to 72 hours. Hypocalcemia زي ما حكينا as a complication due to loss of calcium, deposition of calcium together with fat necrosis. CT scan or MRI to visualize the enlarged inflamed pancreas. This is an example of a CT scan of a patient with pancreatitis. This is the pancreas. شايفين how it is very edematous, very inflamed. This is surrounded by leakage of fluid on, and there is area of fat necrosis in here. Okay, this is a picture of severe acute pancreatitis. Complications زي ما حكينا, it could be related to serious sequelae. So it could lead to electrolyte disturbances, peripheral vascular collapse and shock, especially in cases of hemorrhagic pancreatitis. Disseminated intravascular coagulation لأنها بتعمل لي زي ما حكينا widespread inflammation, widespread necrosis, acute respiratory distress syndrome due to alveolar capillary injury. Sometimes it might lead to acute renal failure, especially إذا كان في severe loss of blood in hemorrhagic cases. Endotoxemia from breakdown of the barriers between the GI flora and the bloodstream. زي ما حكينا, pancreatitis is an emergency that has to be treated very rapidly. We have to remove the underlying cause. The patient has to be kept admitted to the hospital most of the time بالICU بدخلوا. There's duodenal obstruction, other complications. Duodenal obstruction, widespread metastatic fat necrosis زي ما شفنا, Infected pancreatic necrosis اللي هو in 40 to 60% in cases of acute necrotizing pancreatitis اللي شفناها اللي فيها total necrosis of the pancreas, it might become infected by gram-negative organisms and form widespread abscesses and might lead to septicemia. Pancreatic abscesses is a collection of pus resulting from tissue necrosis, liquefaction and infection, and pancreatic pseudocyst. The pseudocyst بيكون pancreatic tissue is totally necrotic and it leaves a wall of edematous fibrous tissue بنسميه pancreatic pseudocyst. حدا عنده سؤال؟ طيب treatment رنيم go ahead.
دكتورة بدي أسأل بالأكيوت بنكرياتايتس ليش ما بصير في عنا هيموريج؟ يعني ليش فصلتها؟ ليش في حالات بصيرش فيها هيموريج؟
It depends on the severity of the affection of the pancreas. The other thing اللي هو involvement of blood vessels. ليش هدول الناس بصير في عندهم hemorrhagic وهدول لا؟ I'm not sure يعني. It depends on the involvement of blood vessels. يعني إذا كانوا the blood vessels are severely or rapidly involved by necrosis ممكن يصير في عندي hemorrhage. I'm not sure ليش بصير عند ناس hemorrhagic وناس عندهم acute necrotizing only.
بس أغلب الحالات بتكون هيموريجيك صح؟
أغلب الحالات لا necrotizing.
without hemorrhage؟
يعني it could be complicated by some sort of hypovolemia لأنه زي ما حكينا it leads to electrolyte imbalance تعمل لي acute renal failure. So it can be complicated by shock يعني okay even without hemorrhage.
أوكي دكتورة.
يعني هدول على severe spectrum of the acute pancreatitis. يعني لما نوصل لمرحلة acute necrotizing pancreatitis والacute hemorrhagic pancreatitis most of the time بيكونوا patients are severely ill وبيكونوا admitted to the hospital. A lot of the cases especially الناس اللي عندهم acute pancreatitis they undergo multiple surgeries. يعني حتى they operate on them more than one time عشان أعمل total resolution أشيل البنكرياس وأشيل necrotic tissue around and so on. طيب treatment and prognosis of acute pancreatitis. Supportive therapy.
ممكن تعيد السودوسيست؟
Pseudocyst is one of the complications بعد ما يصير في resolution of the acute pancreatitis. Sometimes بيصير في total necrosis of the central part of the pancreas surrounded by reactive fibroblastic fibrous reaction of the pancreas. فبالنص بيكون في center necrotic center وعلى الطرف في remaining parts of pancreatic tissue مع reactive fibrous tissue. Okay. فبتضلها البنكرياس as a tissue which is empty from inside. فبنسميها pseudocyst زي كيف الcyst. مش empty يعني فيها fluid collection.
تمام.
Okay. So most individuals eventually recover, especially in the cases of mild acute pancreatitis. 5% die from shock during the first week due to complications. Surviving patients' outcome includes sterile pancreatic abscesses or pancreatic pseudocyst formation as complications. So 5% is a high percentage. يعني لأي disease نحكي 5% mortality rate or 5% death rate is very high. Okay. يعني it is serious, might lead to death of the patient, especially in severe cases. Excuse me. Okay. حدا عنده سؤال؟ هتاخدوا بريك؟ اوكي خلينا ناخد بريك for 10 minutes ونرجع على 8:55 please. اوكي تمام. يلا بسم الله الرحمن الرحيم خلينا نرجع. Okay, for the next part رجعتوا معي؟ Okay. For the next part of this lecture, we will talk about chronic pancreatitis ورح نحكي على pancreatic tumors. Chronic pancreatitis, if you remember لما حكينا in the beginning, this is an irreversible condition which is characterized mainly by fibrosis. كل chronic inflammation inside our body is characterized by fibrosis. So it is irreversible. Long-standing inflammation leading to fibrosis. It is most commonly due to recurrent bouts of acute pancreatitis, common in the middle age, especially in men, and the endocrine parenchyma is lost late in the disease. Causes of chronic pancreatitis, they do share some of the causes مع acute pancreatitis. Most common cause is prolonged alcohol abuse. وحكينا الالكحول بيعمل injury of the pancreas and by multiple mechanisms. Long-standing pancreatic duct obstruction like the formation of pseudocyst, caliculi, neoplasms, pancreatic divism. Tropical pancreatitis in Africa and Asia, and this is mainly related to malnutrition اللي هو protein deficiency malnutrition لأنه it alters malnutrition alters the structure of the cell and increases the incidence of having recurrent bouts of destruction مع release of some of the mediators leading to pancreatitis. Some of the hereditary pancreatitis اللي حكينا PRSS1 mutation and the SPINK1 mutation. Cystic fibrosis mutation لأنها it decreases the bicarbonate secretion and leads to very thick secretions كل البودي منهم البنكرياس and it might lead to secondary obstruction. Idiopathic in 40% of the cases of chronic pancreatitis. Mechanism or pathogenesis of acute and chronic pancreatitis. So the top picture here is the acute pancreatitis. وحكينا acute pancreatitis there has to be acinar cell injury as a net result of the condition. So there will be inflammation and release of mediators which leads to vascular injury and might lead to ischemia. This is secondarily causing acinar cell injury by the release of some of the mediators. Increase in activation of proteolytic enzymes, activation of clotting cascade, more and more of inflammation, وزي ما حكينا بتصير زي cycle. If the underlying disease is removed or underlying cause is removed, and especially in the less severe cases, بصير فيه total regeneration and resolution of pancreatitis in case of acute pancreatitis. Chronic pancreatitis, it is the same. There is injury, بس ما بتعمل لي necrosis of the acinar cells. يعني acinar cells, they do have some of the changes بس ما يصير فيهم necrosis. مع repetitive injury with release of some of the inflammatory mediators like transforming growth factor beta, which leads to activation of fibroblasts through the platelet-derived growth factor. يصيروا هدول الفايبروبلاست أو stellate cells produce fibrous tissue, which is the hallmark of chronic pancreatitis. مع progressive fibrosis بصير فيه gradual loss of the acinar cells. With time مع fibrosis بصير فيه gradual loss of the acinar cells بس ما فيها prominent injury from the beginning. يعني بالعادة loss of the acinar cells is the result of progressive fibrosis rather than the initiating event. Chronic pancreatitis زي ما حكينا the hallmark is fibrosis. يكون pancreas like in this case is fibrotic and hard. Sometimes بشوف فيهم dilated ducts in between. يعني some of the times due to fibrosis, progressive obstruction of some of the ducts بصير فيهم dilatation of the ducts. This is the microscopic picture of chronic pancreatitis, and if you can see تقريبا كل البنكرياس is replaced by fibrous tissue مع areas of ductal dilatation and cystic dilatation. This is another picture of cystic dilatation with formation of إيش بنسميه ductal completions, which are collection of secretions inside the ducts مع condensation of the secretions inside the ducts because of the progressive fibrosis بصير في obstruction أو narrowing of parts of the ducts and dilatation of the parts proximal to this duct. Okay, زي ما حكينا بالchronic pancreatitis it affects بالأول الأسينر parts وبتعمل لي fibrosis. Sometimes اللي هو due to the loss of acini الislet cells it aggregate together. يعني الislet cells إذا شفتوا normal appearance of the pancreas they are very small in number compared to the acinar cells. يعني most of the pancreas is made up of acinar cells rather than islet cells. لما يصير في loss of the acinar cells بيصير في زي كأنهم islet cells they coalesce together فبيعملوا لي large aggregates of islet cells في Langerhans. لما يكون ال disease is more severe وصار في progression more even the islet cells راح يصير فيهم fibrosis وراح يصير فيهم injury. Okay. Clinical features they present with recurrent vague abdominal pain and jaundice زي ما حكينا if the fibrosis affects the head of the pancreas mainly ممكن يصير في عندهم jaundice. Mild fever and modest increase of serum amylases. Attacks could be precipitated by conditions like alcohol abuse, overeating, it increases the demand on the secretion of the pancreas, opiates, which might lead to aggravates the obstruction by contraction of the sphincter of Oddi, the ampulla of Vater. It may be entirely silent until pancreatic insufficiency and diabetes mellitus develops. يعني sometimes في ناس بيضلوا asymptomatic until they present with diabetes. لما نعمل imaging للpancreas بيكون totally fibrotic pancreas. Prognosis is not an acutely life-threatening condition. However, a long run, it carries bad prognosis. 50% mortality rate over 20 to 25 years. زي ما حكينا, this is an untreatable, irreversible condition, مش زي acute pancreatitis. Complications are mainly related to chronic malabsorption, لأنه بصير في loss of the pancreatic secretions, diabetes mellitus, especially late in the course of the disease, لما الislet cells يصير لهم fibrosis and degeneration. Widespread metastatic fat necrosis. Pancreatic pseudocyst develops in 10% of cases of chronic pancreatitis. It is much more common with acute pancreatitis. Individuals with hereditary pancreatitis have, زي ما حكينا, high risk of development of pancreatic cancer. Okay, حدا عنده سؤال؟ نيجي على neoplasms of the exocrine pancreas. Most of the tumors أو exocrine pancreas could be cystic or solid. Cystic neoplasms اللي هم 5 to 15% of all pancreatic cysts and less than 5% of all pancreatic neoplasms are cystic. يعني mostly the pancreatic cancers are solid cancers rather than cystic. In a minority of cases اللي هم less than 5% ممكن يكون في predominantly cystic, يعني predominantly made up of spaces filled with fluid. Serous cystadenoma, mucinous cystic neoplasms أو intraductal papillary mucinous neoplasm اللي هم هدول مش مطلوبين منكم. أوكي؟ هيك حطيتهم in gray color. نيجي على pancreatic carcinoma. Pancreatic carcinoma is the fourth leading cause of cancer death. Okay, it is a very bad cancer. A very deadly cancer. الناس اللي بيصير في عندهم pancreatic carcinoma survival تبعهم is measured in months rather than in years. It has a very high mortality rate. It is a disease of elderly between the ages of 60 to 80 years in 80% of the cases, and it's commoner in blacks. Pathogenesis is multifactorial. There has to be precancerous lesions, molecular carcinogenesis رح نحكي عنها in details, and some of the environmental factors, and in a subset of patients بيكون في عندهم familial syndrome هلا رح نحكي عنها. Molecular carcinogenesis اللي هم it is usually accumulation of genetic mutations rather than a single mutation. So البنكرياس بيكون في activation of the KRAS أو over expression of KRAS, P16, MAD4 and P53 inactivation or loss of function. كل هدول they form pancreatic cancer. يعني accumulation, stepwise accumulation of these mutations lead to pancreatic cancer. Environmental factors, smoking is a very important contributing factor. So if the patient is having the right genes, the right genetics, and he is a smoker, he has a strong, يعني مش strong, يعني a high proportion of persons اللي عندهم pancreatic cancers are smokers. Alcohol also, chronic pancreatitis زي ما حكينا, especially which is related to familial chronic pancreatitis or genetic chronic pancreatitis. Diabetes mellitus usually is the result rather than the cause. يعني لما الكانسر it progresses ويعمل لي invasion into the islets of Langerhans ممكن يصير في diabetes. Familial syndromes, sometimes the pancreatic cancer could be part of familial syndrome. متذكرين لما حكينا على لينش syndrome, لما حكينا على hereditary and polyposis colorectal cancer. These persons ممكن يصير في عندهم colorectal cancer and pancreatic cancer. Hereditary breast and ovarian cancer, BRCA2 mutation. Familial atypical multiple melanoma syndrome أو FA-MMM, which is related to P16 mutation. Hereditary pancreatitis إذا بتتذكروا حكينا على PRSS1. والبيتس-جيجر syndrome اللي بصير فيهم hamartomatous polyps and some cases develops, especially syndromatic, they develop colon cancer, CK11 and LKB1 mutations. First appearance of the pancreatic cancer. 60% of the cases arises in the head of the pancreas, وزي ما حكينا they present with jaundice because of the common bile duct obstruction. 15% in the body and 5% in the tail, and most of these cases لأنه they present late until they are large لأنه ما بيعملوا symptoms, ما بيعملوا jaundice زي carcinoma of the head of pancreas. And 20% diffusely involves the entire organ. Grossly hard, stellate, gray-white, poorly defined masses لأنهم بيعملوا لي desmoplastic reaction. Extrapancreatic extension is common. Sometimes they extend outside of the pancreas. هاي شكل البنكرياتيك كانسر، شايفين كيف شكله؟ hard areas of hardening, stellate يعني زي كأنها فيها central area of hardening مع branching هيك radiating branching بنسميها stellate. Okay, this is the lumen of the duodenum if you can see. The head of pancreas is attached to the lumen. This is a tumor that invaded already the lumen. شايفين هاي اللومن المفتوح هون. This is the lumen of the duodenum وهاي the head of pancreas. في tumor. Microscopy, it's made up of لأنها it's an adenocarcinoma, so it's made up of ducts. Desmoplastic reaction with malignant glands. Neural invasion اللي هم invasion around the nerves is common, and lymphovascular invasion is also common. هاي شكل pancreatic cancer. Desmoplastic reaction عبارة عن fibrous tissue in between the malignant glands, وهدول كلهم these are all malignant invasive glands in pancreatic adenocarcinoma. Tumor spread, it could spread directly to the adjacent organs زي ما شفنا بالduodenum and the nerves. Lymphatic spread into the lymph nodes and distant metastases, especially to the liver. Clinical features زي ما حكينا, early lesions are asymptomatic. Symptoms could be related to, excuse me just a minute. Okay, early lesions are asymptomatic. Symptoms could be related to the pain, which is the first symptom. Usually زي ما حكينا, it's vague pain, obstructive jaundice in the head of pancreas. Migratory thrombophlebitis or Trousier's syndrome it happens in 10% of patients. It is very highly indicative of pancreatic cancer. إيش اللي بصير عند هدول الناس؟ بصير في عندهم inflammation of the blood vessels اللي هو venous blood vessels mainly, inflammation and thrombosis of venous blood vessels, which is migratory. Migratory يعني بصير مثلا عندهم superficial veins of the legs شوي بصير في عندهم thrombosis and inflammation، بصير في عندهم pain in the blood vessels of the legs. بعدين it resolves بتروح على مكان تاني، هاي بنسميها migratory thrombophlebitis. Some of the tumor markers إذا بتتذكروا حكينا عنهم بالgeneral pathology like CEA carcinoembryonic antigen and CA19-9 هدول could be elevated بالناس اللي عندهم pancreatic cancer. Prognosis زي ما حكينا it is very poor prognosis. The most important prognostic factor is the stage of the disease, and the 5-year survival rate is dismal. Less than 5% only of patients survive up to 5 years. Less than 20% of cases are resectable at the time of diagnosis. زي ما حكينا most of the time بيكونوا already advanced, already invaded the surrounding structures, already metastasized. حتى عنده سؤال؟
دكتورة
اوكي.
الفاميلياري سيندروم ممكن تعيديها مرة ثانية؟
الفاميليال syndromes اللي هم a group of الفاميليال syndromes أو familial clustering of pancreatic cancers. هدول الناس بيكون في عندهم genetic mutations that predisposes these persons into multiple organ cancers. يعني بصير في عندهم cancers in more than one organ. منهم الهيريديتري نون بوليبوسيس كولوريكتال كانسر إذا بتتذكروا اللي هو اللينش سندروم. حكينا اللينش سندروم بيكون في عندهم microsatellite instability and mismatch repair DNA mismatch repair genes بيكونوا defective. So they present mainly with colon cancer, and one of the extracolonic cancers اللي بتصير عندهم is excuse me اللي هو البنكرياتيك كانسر. الهيريديتري breast and ovarian cancer أو BRCA2 رح نحكي عنه in details بالUGS إن شاء الله. These persons بيكون في عندهم high risk of development of breast cancer, ovarian cancer and pancreatic cancer. الفاميليال atypical multiple mole melanoma syndrome هدول الناس بيكون في عندهم tendency to have multiple melanomas in different parts of the body. من ضمنهم من other manifestations not related to the skin اللي هو pancreatic cancer. Hereditary pancreatitis PRSS1 اللي هو بتعمل acute pancreatitis, chronic pancreatitis وبتعمل pancreatic cancer. Pathogenesis syndrome اللي هو حكينا عنها in details بيكون associated with hematomatous polyps of the GI tract وممكن يصير في عندهم high risk of development of colon cancer مع pancreatic cancer. Familial syndromes إنه they do have mutations which are to be inherited, and these mutations predisposes to carcinomas of the pancreas إضافة إلى carcinomas outside the pancreas. هذا عنده سؤال؟
دكتورة بدي أسألك هسه كيف البايل سوبر ساتوريشن بيعمل انفلاميشن؟
البايل سوبر ساتوريشن البايل by itself is a chemical irritant, okay؟ يعني واحدة من الchemical irritants, especially صار في super saturation and stasis of bile inside the gallbladder. This causes continuous chemical irritation to the wall, فبيعمل لي chronic inflammation. Okay.
شكرا دكتورة.
دكتورة.
Okay رنين.
المولكيولار كارسينوجينز هو بتكون الميوتيشن restricted للبنكرياتيك سيلز صح؟ ما بتكون يعني mutated in the other organs أو هاي الميوتيشن ما بتكون موجودة بالother tissue rather than the pancreas صح؟
لا هلا ال P53 لما يصير له mutation it affects multiple organs يعني مش بس P53 كل الميوتيشنز هدول إذا بتتذكروا لما حكينا مثلا على الكيراس وال P16 وال SMAD4 وال P53 حكينا they are very common in multiple organ يعني They are very common in a lot of the human cancers, especially الكيراس إذا بتتذكروا حكينا عنها. What determines متى يصيروا هدول mutations? It depends on the rate of proliferation إذا بتتذكروا. حكينا sometimes إذا كان في influences from outside، إذا كان مثلا في radiation، في some sort of carcinogens that affects these genes. It depends on the localized symptoms. يعني مثلا الناس اللي عندهم مثلا chronic pancreatitis they have higher incidence of having pancreatic cancer. ليش؟ لأنه they are more predisposed to inflammatory mediators of the pancreas. هذول inflammatory mediators they act on the cells. Sometimes they are injurious to the cells. They might accumulate. In case of pancreatic cancer, like for example, they are unique to the pancreas. لما يصير بس pancreatic cancer. But these mutations مش بس بالpancreatic cancer بيصيروا. So they can give rise to other malignancies depending on what is happening in the organ itself.
دكتورة بسأل كمان سؤال بالنسبة حكينا آخر شيء بالبروجنوسيس the most important prognostic factor is the stage، يعني حسب الليفل اللي فيه الكانسر المقصود فيها هون.
الستيج إذا بتتذكروا التيومر ستيج حكينا بالكارسينوماز نستعمل TNM staging. T is for the tumor, N is for lymph node metastasis, M is for distant metastasis, involvement of other organs. T stage بالpancreas it depends on the size of the tumor وقديش داخل على organs surrounding organs. Okay, T stage. N is the same for lymph node metastasis M is for distant metastasis. كل هدول ال T and M نسميهم stage, tumor stage.
تمام دكتورة، يعطيك العافية.
الله يعافيك. حدا عنده سؤال؟ حدا عنده سؤال؟ اوكي احنا هيك خلصنا، بس المرة اللي بضل عنا اللابات. اوكي next week ان شاء الله رح انسق مع حمزة او مع يزن وبرد لكم خبر متى حيكونوا اللابات. اوكي يوم الأحد على 3:30 عندكم إشي؟ خلاص we will arrange later on. حدا عنده سؤال؟ يعطيكم العافية.